What is pelvic floor reconstruction? Pelvic floor reconstruction is a group of various surgical procedures used to treat pelvic organ prolapse, a condition that occurs when the muscles of the pelvic floor are weakened or damaged, often due to childbirth. Other causes include repeated heavy lifting, chronic disease, or surgery. The pelvic floor includes the muscles, ligaments, connective tissue, and nerves that support and control your bladder, uterus, vagina, and rectum. The pelvic floor holds the structures in your pelvis in place. Your pelvic floor is a very complex layer and usually functions very well, but it can be damaged if too much stress is placed upon it. In particular, childbirth and the tremendous forces of labor all act to weaken, damage, or break your supporting tissues. Why pelvic floor reconstructive surgery may be necessary. When these weak or damaged muscles are no longer able to support the weight of the pelvic organs, one or more organs may drop or prolapse below their normal positions and press against the walls of the vagina. These sagging or falling organs can cause pain, discomfort, pressure in the vagina, and urinary and bowel dysfunction, among other symptoms. If there is complete failure of your pelvic floor, you can develop loss of bladder support, loss of rectum support, loss of uterine support, loss of upper vagina support, and loss of vaginal side wall support. When non-surgical treatments aren't effective, pelvic floor reconstruction is used to restore the normal structure and functions of the female pelvic organs. Corrective surgery can be performed either through the vagina or the abdomen, depending on the support problem. There are several procedures for correcting pelvic organ prolapse. A pelvic floor reconstruction is a major surgical procedure that is designed to restore strength and integrity to the pelvic floor by addressing each of the possible prolapsing organs one by one, and either rebuilding the supporting layer or removing the fallen organ. If your uterus is still present and you have completed your childbearing, then you should consider having your uterus removed during the pelvic floor reconstruction procedure. The uterus acts as a weight, sitting atop the vagina, and can be detrimental from it pushing down on your vaginal support tissues. Chances are, if you are having problems with pelvic support, then you may already have some degree of uterine prolapse. A laparoscopic hysterectomy will add little recovery time and may greatly improve the quality of your life. Please call one of our dedicated and caring physicians at Professional Gynecological Services today for more information and to make an appointment to come in for a consultation. We look forward to speaking with you.